The question really has to do with late life depression in the context that what you sometimes see, you could probably talk to this. What you sometimes see when somebody loses their life partner is kind of what I always call the dwindles. The person becomes more sedentary. They lose the joy. They don't have the activity they had, and consequently they may develop adverse health conditions such as what you're describing as mini strokes.
They worry so much.
Well, I don't know about worrying causing mini strokes, but they develop them. And so they can look very much like a patient with Alzheimer's disease, and there are tests now that we can do that we can distinguish between Alzheimer's and post-stroke depression or multi-infarct dementia. One of the things, though, that if you look at long-term studies of those people who had what are called depressive pseudo-dementia, I mean, you can be so depressed that, whenever I ask you, do you know what today's date is, you'll say, I don't know. Okay, and when I ask you what's 2 plus 3, you say, I don't know. Are you demented, or are you just not able to concentrate? And sometimes it can be very, very difficult to make that distinction. After the age of 55, if you have that pseudo-dementia, the depressive pseudo-dementia, and you follow the person for another 10 years, the majority of those patients will actually be diagnosable with Alzheimer's. So which came first, the chicken or the egg? We know that inflammation has something to do with depression in some people, and we know that it has something to do with Alzheimer's disease in most people. And so, you're really kind of asking the question, was it early Alzheimer's in that condition that then led to the depression that then later surfaced as full-blown Alzheimer's? With the scenario you gave me with the multi-infarcts, the question really becomes, did they have those before and they're only being unmasked because they're not taking care of themselves and things like that? So.